Welcome back, everyone. As we've been talking about already, the search to find open ICU beds is intensifying. We've reported Mississippi's largest hospitals are all out of ICU beds.
WCBI's Stephen Pimpo rides along with a team of flight nurses for a critical care transport service today. And now he joins us live in the studio with the story. Stephen?
Joey, Andrea, the flight nurses at PHI Air Medical Center describe what they do as taking care of patients at a high level in the equivalent of a phone booth flying at a couple thousand feet in the air. But it's their specialized flights that are saving lives.
The beds are the beds. If they don't have them, they don't have them for COVID, or they don't have them for your heart attacks, or they don't have them for your traumatized patients.
The COVID-19 Delta variant is once again causing ICU beds not only in Mississippi, but all across the South to fill up fast.
The requests are coming in from all over. There's so limited bed space, intensive care bed space now in the Southeast.
Eddie Coates and the team of flight nurses at PHI Air Medical are some of the ones in charge of getting those patients to their much-needed ICU beds and providing any emergency care they may need while in flight.
Once we get a request, we have to look at the possibility of taking it. Is it a viable flight? We have weather considerations, weight considerations, distance.
Coates says that distance keeps increasing. Last month, PHI's 3 helicopters transported close to 100 Mississippi patients, flying as far as Nashville to find that open ICU bed.
We had one today from central Alabama to Springfield, Missouri.
OCH Regional Medical Center ICU Director Jacob Leggett says they count on teams like PHI on a regular basis.
Whenever we have a patient that gets accepted to another facility, if it is a critical patient, more times than not that we're going to be calling an air service.
Leggett says they're relying on them more than ever with the current healthcare worker shortage.
If PHI or another air service can transport that patient, that keeps our guys here in the county being able to serve our citizens here instead of being on a long transport with a critical patient.
Coates says the number of COVID-19 patients they've transported has increased over the last 2 weeks, and he only expects that number to grow.
The peak of the COVID, we were transporting quite a few patients with COVID that represented the bulk some weeks of our patient transports. We expect with the trends that we're seeing with this Delta variant that we're going to experience the same type situation within the next several weeks.
With the demand for their services expected to increase, a PHI team installed a direct phone line at OCH Regional Medical Center today so that they can call dispatch as fast as possible. They say they're installing them at any hospital that would like them.